You may remember the early days when the conspiracies were about the origins of the virus, some even believing that governments around the world were purposely spreading COVID to control the public, calling it a plandemic. There were theories about masks, quack doctors claiming that masks were more likely to get you sick than to protect you. Several internet personalities like Joe Rogan and Elon Musk got on board, spreading miracle cures to their audience of millions. Remember ivermectin and hydroxychloroquine? The drugs that public health officials found actually did not have any benefit to COVID patients at all. And let's not forget when the then president got up to the podium in the White House briefing room and suggested injecting bleach. And then, when a couple of highly effective vaccines came around that were the solution to get back to some sense of normal, the anti-vaxxer movement kicked it into overdrive. People were claiming that the vaccine contains a microchip so that Bill Gates and the government can track your every move. People were putting spoons and keys up to their face saying that the shot would make you magnetic. Some were even claiming that all the deaths we were seeing were not from the virus, but rather from the vaccines. The pandemic created the perfect environment for conspiracy theories to grow and to enter the mainstream. In the meantime, Americans were dying, at times thousands per day. Millions of others were hospitalized or experiencing long COVID. Fast forward to today, and COVID is once again on the rise. Cases have risen roughly 55% over the past 2 weeks, while deaths have surged by around 65%. Hospitals are once again being pushed to the brink, some running out of beds due to simultaneous increases in COVID, the flu, and RSV. But in Florida, where a disproportionate 83,000 people have died of COVID, Governor Ron DeSantis is spending his week forming a committee to counter the CDC and called on his state Supreme Court to greenlight an investigation of any and all wrongdoing in Florida with respect to COVID vaccines. And take a listen to what Kentucky Senator Rand Paul had to say yesterday.
What do you tell your patient who says, I've been vaccinated 3 times and now I've had COVID? Did it help me to have gotten COVID? Of course it did. Having gotten the disease naturally is like a vaccine, but an even better vaccine.
A reminder for the senator, more than 17,000 people have died from COVID in your state. But this is nothing new from Rand Paul, who was one of the first Republicans to give oxygen to conspiracy theories about Dr. Anthony Fauci, even going after him during COVID hearings and then fundraising off of it. Those conspiracies were so rampant that the doctor and his family have received death threats. But that didn't stop the Republican Party. Even now, with the rise in infections, their priority isn't keeping their constituents safe, but rather investigating the man who has dedicated his entire career to finding cures and treatments for deadly diseases. Elon Musk is even getting in on it, tweeting, "My pronouns are prosecute Fauci," throwing in a gratuitous swipe at trans folks because, of course, while at the same time rolling back Twitter's COVID misinformation policy and replatforming thousands of users who have spread conspiracies to the public. And joining me now is Dr. Anthony Fauci, Chief Medical Officer to President Biden and Director of the National Institute of Allergy and Infectious Diseases. And Dr. Fauci, I just want to start by thanking you for doing what you do, because it wasn't easy to do what you do when it was the HIV/AIDS crisis and you had to educate a public that had negative views toward the people who were getting sick. That was bad enough. But now you're doing it under a kind of duress that I could not have imagined in my lifetime. So I just want to give you an opportunity to talk just for a minute about what it has been like to be the hate object at the center of COVID when people like Rand Paul, who was ostensibly a doctor, although he gave himself the certification to that, are attacking you daily and threatening you.
Well, I don't really pay much attention to that. I know that's difficult for some people to believe, but I focus on what my job is, what my mission is, and what I've, as you said, what I've devoted my entire professional life to, and that is to protect and help to keep America healthy, to protect their health and to protect and defend them against diseases such as COVID and HIV. If I focused and got distracted by all that other noise, it would really be detrimental for me to do my job. So I just phase that out and I just focus on what I should be doing. And that is what we have been doing, developing the vaccines and encouraging people to accept the vaccines, which, a report came out from the Commonwealth Fund just last week that showed that vaccinations over the last 2 years have saved 3.2 million lives 18 million hospitalizations were averted, and $1 trillion were saved. So when people start interfering with people getting vaccines by downplaying it or putting conspiracy theories, unfortunately, that results in the loss of lives of people who could have been protected by a vaccine, who chose, for one reason or other, mostly misinformation, not to get vaccinated. So that's what I focus in on countering that. That other noise, I don't pay attention to.
Well, you know, the thing is, the reason I bring it up, Dr. Fauci, is that we have a unique situation here. You know, when the polio vaccines first came out, there was misinformation and conspiracy theories then, too. But there also wasn't the internet, and there weren't podcasts, where people are literally beaming into very specific audiences misinformation. The black audiences got a lot of it early on, but Republican audiences got it intensely, to the point where there is data showing that Republicans have died of COVID at higher rates than Democrats, that it's actually causing a partisan divide in who dies, whereas we're so used to in past issues and pandemics having it be disproportionately people of color. No, it's disproportionately Republicans. You had people like Herman Cain who died after being in this disinformation whirlwind. You've had a lot of radio hosts, a guy named Dick Farrell, Phil Valentine, Mark Bernier. They're actually literally preaching disinformation and then dying. So what do you do to try to get people to accept the idea of saving their own lives and getting vaccinated and helping to mitigate the impacts if there's a partisan divide on whether you should take the vaccine?
Yeah, I'm not so sure what we can do about that, but except to continue to put out correct, evidence-based information based on data, information based on the truth. And you're absolutely right. It's really unconscionable and painful to see someone who suffers and dies and perhaps influences their family to suffer and die based on an ideological consideration. No one wants to see anyone get sick and die from COVID, whether you're a conservative, a liberal, or somebody in the middle. It doesn't make any difference. Everybody's life is precious, and it really is awful that some people put themselves in danger merely because they don't want to accept, or ideological differences make them believe something that is not true.
You know, we're in a dangerous period right now. We're seeing this triple sort of pandemic of flu, RSV, and COVID hitting hospitals really hard. Long COVID, just a quote here from the Washington Post, a study released Wednesday by the National Centers for Health Statistics found that more than 3,500 Americans died of long COVID-related illnesses. And you've only got 13% of people who've gotten the latest booster. Republicans are preparing to take over the House, and they're about to waste a lot of time and money dragging you before committees to interrogate you. That is what they have said they're going to do. It's what they're going to do. And so I'm wondering if, without you being in the position you're in right now, is there something that can be done to get back to the focus on that, on the fact that long COVID is really hurting people, and we're going to see another wave of COVID this winter?
Well, both of the things you said, Joy, are true. In fact, we are going to see an uptick in cases as we get deeper into the colder months of the winter when we approach the end of the year holiday season. People congregate indoors. There's going to be an uptick in infections, and with that, an uptick in hospitalizations and even deaths. We have the wherewithal and the tools to mitigate against that. We have COVID vaccines. We have the booster that you spoke about, that only 13% of the eligible population is utilizing that booster. That is unacceptable. We've got to do better than that. And you're right, we do have other infections now. We have a very sharp spike, almost a vertical spike in influenza, and we have a good influenza vaccine that's well matched to the circulating strain of influenza. So we're trying to get the population to appreciate that we have the tools to protect us. We've got to get people to utilize them more as we get into a more dangerous situation of the colder months.
And what do you say to people who, have had family or friends, or they themselves got vaccinated, sometimes even got boosted and still got COVID, and now don't want to take another booster because they just don't believe in the vaccines at all?
That is an understandable misunderstanding. And let me explain what I mean by that. Of course, when people say I got vaccinated and then I got infected. So why should I wind up getting another shot? But what they don't appreciate is that if you look at the statistics of the difference between unvaccinated people and people who are vaccinated and boosted with regard to progressing to hospitalizations and death, overwhelmingly the greater percentage of serious illness and death is among people who have not been vaccinated and have not updated their booster shots. Again, we have within our own power to protect ourselves. We need to utilize that and implement it.
Do you have a plan for? Are you going to retire, or what are you going to do in your life after this very harrowing job?
Well, I'm going to step down, as I've announced, from the federal government at the end of this month, the end of December. But I'm not retiring in the classic sense. I'm going to still be very actively involved in public health issues, in lecturing and in writing, and hopefully inspiring the younger generation to take a consideration of going into science or going into public health, and hopefully even going into public service. I have the experience of being in the government as a scientist for 54 years and as the director of the Institute for 38 years, and I've had the privilege of advising 7 presidents over that period of time. So I hope that I can use that experience to inspire some people to pursue a career in science, medicine, and public health.